Hello, I am Dr. Lorance Peter, consultant gastroenterologist and director of Department of Gastroenterology and Hepatology at Sakra World Hospital. Today, we will be talking about cirrhosis. And you must have heard about cirrhosis from some colleagues or some friends or relatives, or sometimes you know that is a common disease affecting liver. So what exactly is cirrhosis? Cirrhosis means hardening or becoming like stone, which means that the liver becomes hardened, scarred, and nodular and shrunken. So there is a permanent damage to your liver, irreversible damage in the form of scarring, shrinking in size, and decrease in liver function. And what are the causes of liver cirrhosis? Liver cirrhosis can be caused by alcohol and viruses, autoimmune diseases like autoimmune hepatitis, primary biliary cholangitis, primary sclerosing cholangitis, and metabolic diseases like Wilson's disease and other disorders. And what are the usual symptoms? Many a times, I would like to warn you that many a times the patients can remain perfectly without any symptoms. They might feel little tiredness or lethargy, weight loss, muscle loss, lack of appetite. These are general symptoms. These could be the early symptoms. As the days go by, as the liver functions come down, they start developing fluid retention in the form of leg swelling or edema, or abdominal distension with fluid, or what we call as ascites. The other complications like jaundice, bleeding, and altered mentation and unconsciousness can also happen. And how do doctors diagnose cirrhosis? Cirrhosis can be diagnosed by clinical symptoms, signs, and tests like ultrasound and CT scan. And sometimes a liver biopsy may be required. Most of the time, it is diagnosed by imaging like ultrasound and CT scan, and other symptoms like fluid accumulation and swelling also will help us to diagnose. The doctor might also do some tests to find out the complications of cirrhosis, like endoscopies to look for varices, and some blood tests to look for the cause for the cirrhosis.